said, can I please do my own introduction? So let me give you the very abbreviated version. I am a prosthodontist. I actually grew up in dentistry. So my dad's a dentist. He's a prosthodontist. And I grew up, I did my undergrad in dentistry at the University of Florida, go Gators, and ultimately went from dental school to my pros program at UCSF, the University of California in San Francisco, back in 2006. And I was really lucky because I was a lucky kid at the right place at the right time, where dentistry was changing, technology was pervading everything we were doing. And so I started my first year of residency waxing and casting and stacking porcelain and processing and boiling out dentures. And by the end of my third year, I was milling titanium frameworks. Just very lucky. That's when the kind of change was occurring. So I got exposed to the latest and greatest in technology and innovation when it came to specifically dentistry and specifically implant dentistry. I was in private practice for over a decade. I was very blessed to have a multi-doctor, multi-location, pure play prosthodontic practice. We placed and restored thousands of implants. I was lucky to be able to grab onto innovation and did a lot of firsts in dentistry. I was the first prosthodontist in the world to have a Yomi robot for robot-assisted implant placement. Fourth person in the world to have one of those units. I have published a ton on various topics, sit on global advisory boards for companies like 3Shape, SprintRay, and others. I have been in the journals and done a lot of publications, like I said, and started my own institute called the Digital Dentistry Institute. Lectured all over the world for companies such as implant companies and Henry Schein and 3Shape and Ivoclar and others. And all of this is really not to just tell you how great I am. That's not the intent. All of this is to show you the level of support that we, Aspen Dental, put into building resources for all of you. And I think it's a really unique differentiator for us as an organization, which is that we feel that our job, our number one job, is to support all of you through lifelong growth and development. And if we believe that that is core to our DNA, then we need to make sure we're making the investments in absolutely the best experts across the world to be able to support you in those endeavors. And so, my story is one about implants, but we could rinse and repeat that when we talk about, just regular dentures. And, our vice president of removable prosthetics, Eric Kukuchka, has helped write the book on denture therapy and is one of the foremost authorities on digital dentistry. And we've got, our vice president of clinical support, Dr. Andrew Gelarosa, who has been one of the most successful people in the Aspen organization as a clinician and owner for, well over a decade. We have one of the best people in orthodontics, Paya Matai, who leads our orthodontic aligner initiative. We've got one of the most prolific placers of implants and zygomatic implants as our vice president of oral surgery, Dr. Des Brown, and the list just keeps going on and on. We really bring together world-class experts to be able to help all of you. But enough about of that, and I'll talk a little bit more about the support later on in the lecture. I want to focus on implants because, look, implants are the number one modality for tooth replacement, whether it's single tooth or full arch. They are the best thing for the patient, the right thing for the patient, the best thing that we can do to offer to help heal patients. And unfortunately, it's one of the least things you guys learn about in dental school. There's so much you guys have to learn in dental school today that you don't really get, I think, enough time. There's just not enough time in the day to get all the exposure you need. And so implants, unfortunately, is one of the I think, most important modalities in dentistry that's probably lacking when it comes to dental education in general. So we try to fill that gap. We try to fill that void and really build robust ways that you guys can grow and develop when it comes to implant dentistry. So when we think about that, why does that matter, right? Why does that matter? Well, it really comes down to, let's take a step back and let's talk about what our goal is and what our goal in implant dentistry specifically And this is my goal. So my goal is what you see here, but gone are the days of us looking at things in black and white. There was a time many years ago where we looked at tooth replacement in black and white. Mrs. Smith, you are going to lose a tooth or all your teeth. You're going to have a big black hole. We're going to fill it with a bunch of white. Okay. And, the great news is you don't have to take that tooth in and out, right? Or those teeth in and out because, we've got this wonderful thing called dental implants. But, we're not really sure what it's going to look like. Hey, it's the best we can do. And, when I started my career, that's how we talked to patients. But gone are the days of looking at things just in black and white. Today, we look at things in color, in black, white, and pink. We look at hard and soft tissue, and how do we look at recreating nature or the illusion of nature, where your goal is you can't tell what is an implant restoration and what's a natural tooth. That's our goal. And so my goal is what you see here, a happy, healthy patient. She loves her smile. She doesn't think about a missing tooth or teeth. She doesn't worry about her dental care. She loves her life and lives her life. And she enjoys going to a restaurant and eating food and not thinking about, do I have to take out a partial denture every time? Do I have to rinse my mouth out? I'm embarrassed. I don't like to socialize. I don't like to go out with friends, or I can't get the job I want because I don't have confidence. But this is our goal, a happy, healthy patient. I think the real question is, how do you get there when someone presents like this? Okay. And you guys will come across this in your careers if you haven't seen it in dental school already, which is a patient who comes in and they've already had implants placed. Right? Implants obviously are one of the fastest growing modalities in dentistry. Lots of people are providing implant care. So it's not uncommon for a patient to come in and already have implants placed. So this patient presented to me well over 15 years ago now. And her chief comment was, I'm ready to go. I had implants placed out of the state of Florida at the time. She moved to Florida. She ended up in my chair, and she's like, "I'm ready to go. I got these implants. Let's do this." And so I was not involved in the diagnosis and treatment planning. I did not have any real ability to say where the implant should go. And I'm just there at the last phase of therapy, which is the definitive phase of therapy. And we've got implants that are integrated in her mouth. And so we, went through the process of provisionalization, making her temporaries because we're in the aesthetic zone. We want to see what it's going to look like. And, long story short, when everything was totally completed, this was the final result. Okay. How many of you people think that if you were to look up sundeeprawal.com, beautiful website, all this great information, how great I am as a clinician. How many of you think this photo would have ended up on the front screen of my webpage, of my homepage? Anyone? The answer is no. This picture is never on my website because these teeth don't look right. These teeth, they're funny. There's something wrong with them. The laterals are too short. And the reason the laterals are too short is because these implants got placed too shallow. And so when we went to restore them, we were limited to what we could do from a clinical crown perspective. Now, mind you, these implants are perfectly integrated in the bone. They're probably going to last for 20, 30, 40 years. Crowns are well made. I've got, good shade match, good, hue, chroma, value. I've got great translucency on the inside of the ledge, right? Great made restorations, integrated implants. But I want everyone to understand that today, this is a failure of therapy. My therapeutic outcome is not success because our goal was to recreate nature or the illusion of nature. Our goal is teeth that look like teeth, feel like teeth, or function like teeth. And because on day one, these don't look like teeth should look, in my world, in my mind, this is a failure of therapy. And the problem is it's an iatrogenic or operator error when it comes to this failure. It's totally avoidable today. This is a failure of diagnosis, of treatment planning, of placing and planning implants to be in the appropriate position so that the ultimate restorations were appropriate. And I always start with this because this is really what we're talking about with implant dentistry. Today, implant dentistry is not a discussion around osseointegration. It isn't a discussion of can we get titanium end osseous threaded fixtures to integrate to bone, or can we connect restorations or teeth to those implants? Can we make good restorations out of materials like zirconia or monolithic zirconia with micro layering on the facial? It's not a question of can we get good color matches. It's not a question of, do we go screw retained versus, cement retained. Today it's really about can we recreate nature or the illusion of nature? Can we give the patient the ability to live their life with the optimal outcome? That's implant dentistry today. And when I think about this, I always start with this because it really helps me always remember what my goals are. And it also helps me to have that warning in the back of my mind that if we don't do things right, if we don't take our time and do things through the right processes and utilize the right systems, suboptimal outcomes can occur. And they're very hard to recover from. There's very few good options that you can think about after something like this happens. And so when I think about this, how do we avoid those iatrogenic errors? How do we avoid those suboptimal outcomes? I'm really excited about implant dentistry today because we have great ways to create predictability when it comes to how we deliver implant therapy. And that predictability comes through the use of digital technology. That's why today I say that error that you saw was iatrogenic or operator error, because if you use technology today, you can avoid having those outcomes be suboptimal. Now, that doesn't mean everything will always be perfect and there'll never be a complication, but you can minimize the chance of complications, and you can certainly be predictive. And if you think there might be challenges to deliver care in the optimal way, you can predict it. You can see it on day one. You can talk to the patient. You can set realistic expectations. You can diagnose and treatment plan that you need adjunctive therapy. Maybe you needed bone grafting, right? Maybe you needed to do bone reduction. Maybe you needed to do soft tissue grafting. There's other things. Maybe it's orthodontics you needed, right, to get a great outcome with implants. And so from my standpoint, digital technology allows us to overcome the unpredictable nature of care and then deliver what I think can be truly optimal outcomes for patients that we're helping to heal. And digital technology today is pretty great because we have some robust systems around this for implants. It all starts today with data acquisition and diagnosis. Today, we live in a digital world, a digital dental world, right? And you guys all hear these terms like digital dentistry and things of that nature. And like there's a lot that encompasses. But for implants specifically, in my mind, it really does come down to we're going to start by digitizing the patient, because if we acquire data and we start to diagnose and treatment plan in a digital world, we will have all of the information we need. We'll be able to make sophisticated, educated decisions based off of science, and then therefore be able to come up with treatment plans that we feel confident will get predictable outcomes. So data acquisition in a digital world is the gateway to successful implant therapy. And in my mind, that means we start by acquiring data through really 2 or 3 fundamental things. One, we're going to do things like CBCT, right? So we want to be able to evaluate where bone is in 3 dimensions, and that's done through CBCT technology. It's super important. We believe that every patient should have a CBCT scan when you're thinking about implants, along with a litany of other modalities, but specific for implants, we do believe in diagnosing in 3 dimensions with imaging. So CBCT is very big for us. We have CBCT in almost every one of our 1,200 offices. We're almost fully penetrated with CBCT in every single office. And the only offices that don't have a CBCT are simply because we're waiting to install the CBCT units, because it just takes time to, get the machines installed. But we truly believe in that. And we believe in IOS, intraoral scanning. And so the second pillar of digital data acquisition is to use intraoral scanning to acquire the most accurate way of where the existing surface tissues are, whether it's hard tissues like teeth, soft tissues like gingiva or mucosa. We want to be able to accurately capture that information. So CBCT allows us to image bone. IOS allows us to image soft tissue and hard tissues like teeth. And we then take things like either photographs or videography so we can see what the patient looks like, right? What is their high smile, and have some aesthetic diagnostics. And all of this goes into software today. So you can see where we'll take patients and we'll start to layer that information so that we can make sophisticated, educated decisions. And then we do that through the use of software, where we have some pretty robust tools today, like Smile Design, where we can say, where's the optimal tooth position? Where should the teeth be? In a very predictable way based off of empirical science, right? And we'll take that information and create smiles, right? We can see exactly where we want to go, begin with the end in mind, so that way every step of therapy leads us to that outcome that we want. And if you do this predictably at scale, we can sit there and diagnose, treatment plan, acquire the data. We collect all of that data. Once we have that data, we can then diagnose where we want to create and place teeth. You can see we can have a good before and after plan, and then from there create our prosthetic plan, right? Whether it's for single tooth, whether it's for, in this case, dentures or overdentures, where this patient's ultimately going to go. We can optimally create what our blueprint or plan should be, and then from digital technology layer back how we're going to execute on that plan. So this is software that we use to figure out where teeth should be. Obviously, we can create from here great things like a denture, and then go to manufacture, create a restoration, which in this case will ultimately become overdentures, and you get really great aesthetic outcomes, right? You get great functional outcomes. You get predictability, right? And doing this from a restoratively driven standpoint. And we follow this same protocol. What I love about technology today is it's not like we can just use this on 5 patients or 8 patients. You guys are very young in your careers. You're going to see when you get out, you'll be inundated by people in the industry, manufacturers and companies coming to you saying, oh, use my product, use my service, and you'll be great, and you'll have a fantastic result. Here, look at this case. But the real question isn't, can you get a great result? The real question is, can you get a great result 99 out of 100 times? Is this something that's predictable? Can I use this tool, technology? Can I use this innovation on all my patients? That's powerful. And that's where we are with digital technology today. So you can see how we follow a very similar process when it comes to everything from single tooth to complex full arch implant dentistry. And this is a patient who comes in and, she's, her chief complaint is she's obviously got some teeth that need to be restored. She's going to go through a rehabilitation process. We're going to start with the upper arch here, and we follow a very similar process. So she's got, as you can see, some missing teeth. She's got broken down teeth. She's got teeth that need to be restored. She's actually had some previous implants. And we're going to follow a very similar process. We go through our digital diagnostics. We take our intraoral scans, which in our ecosystem is 3Shape. We use the Trio scanners in all of our offices. We're going to take CBCT. We're going to take photography, videography, whatever you need. We're going to go into smile design. We're going to plan where the patient's smile optimally should be based off of, parameters that are empirical. In this case, it's facially driven dentistry. We look at the face to determine what the smile should look like. From that smile design, we can make really good, sophisticated decisions. In this case, we can even try it in the patient's mouth, do a mock-up if we need be able to say, hey, do you like what our vision is? And create that shared vision with the patient so that they get excited, they're motivated, because now they see truly the potential of what their life can be, right? And what they can, ultimately end up with. And from there, we can do things like actual day-to-day dentistry. We can prep teeth. We can scan implants. We can design restorations. We can do all of these things very predictably. We can utilize technology. You can see here where I'm scanning the existing dentition, right? I'm seeing where we are with provisionals in the mouth that we've been test driving, right? Where the patient's been assessing the vertical dimension of occlusion. She's been assessing aesthetics, phonetics, form, function, fit, right? We can see the occlusion. We can look at bite. We can then layer in other things like, okay, not just the occlusion on the provisionals, but then we can also layer in, okay, what do the preparations look like, right? We can do all of these things through technology. And when we do that, then we start building predictability, because now through a digital ecosystem, I have all of my relevant information. I know where teeth are, the optimal teeth, like the provisionals that the patient's been testing. I know where that is in relation to the opposing dentition. I know where the preparations are. I know where the implants are. I have all of this relevant information, and that means it's really easy to go out and then execute and deliver care, to make teeth, to ultimately come back in and be able to then also um, um, be able to deliver optimal care. So we do all of those things. And like in this case, like I said, it's a combination of crowns, implant restorations. You can see these are screw retained crowns. We're big proponents of screw retained crowns for a lot of reasons. We don't believe in the use of cement with implant dentistry. We believe in utilizing sophisticated technologies like angulated screw channel if you need to. And ultimately, all of this is to deliver optimal care to the patient, build those smiles so the patient is happy, right? And as I said, we follow the same process for every single patient. We build these systems across all of the organization, across all of the offices, so that all of the doctors and teams that we support can utilize these technologies, utilize this innovation, have the support they need for world-class expertise, and then really be able to get through and execute at a high level when it comes to the outcomes they get. So the last clinical case I'll show is the exact opposite of the first case. So the first case, patient comes to me, implants are placed, and it's like, hey, I'm ready to go. And you're like, all right, this is as good as it gets, right? Lots of error. Vastly different than this patient. This patient came in, and this was a 19-year-old who came to me 4 hours after playing basketball and got elbowed in the face and ultimately had this traumatic event. But instead of just placing an implant, we spent the time to do things in the right way with the right systems, the right processes. We diagnosed, treatment planned. In this case, we extracted the tooth, we socket preserved because we wanted to see and make sure no other teeth were affected by the trauma. We came through and utilized digital technology to figure out the optimal place for an implant based on the optimal restoration. We leveraged CBCT, iOS, photography. We went through and did the smile design, all the things we talked about, and ultimately got an implant placed where the implant was in the right position. And that allowed us to do this, which is recreate nature or the illusion of nature, to diagnose and treatment plan and be able to deliver an outcome that will be what we want for the patient to achieve our goal of letting the patient live their life, not have to worry about their teeth, right? Have teeth that look, feel, and function like teeth, where the patient will never have to worry about feeling or functioning like they don't have the best outcomes possible. And this what I've showed you today is 100% how we feel all care should be delivered with dental implant therapy through technology, creating predictable ways to deliver care. And when you think about an organization like Aspen, it does come down to building predictable processes around this, right? We support thousands of clinicians, tens of thousands of team members, over 1,200 plus locations, right? As you guys know, we're the largest branded DSO in the world. And the only way that we can support a variety of clinicians, right, with various levels of experience with dental implants is if we create predictable processes around this. And so I'm very proud of the mechanisms that we've achieved when it comes to this, right? We have a lot of embedded support and systems and processes in place that allow you guys to go out and deliver implant therapies to your patients predictably every single time, right? So what does that really look like? Well, for us, it starts with your learning journey. The number one key to success for all of you with implant dentistry is learning about implantology, is gaining confidence in the skills needed to be able to offer patients the care you want. And we do this through our implant continuum, our learning journey, which subjectively, I'm very proud of. I think it's the best learning journey in implant dentistry in the world. It's very, very thorough. We spent years building this, right? And it starts with things like our implant continuums part 1 and 2, which is online didactic learning based off of ITI content. And ITI is the most robust academic resource for implantology content from an educational standpoint in the world. And we facilitate and bring in live in-person didactic experiences where you start to learn and engage in the classroom setting with world-leading experts. We support you guys online through our TAG University through this. When doctors are ready, we bring you in and take you through the next evolution of your learning journey, which is live restorative courses where you learn to diagnose, treatment plan, and restore in person. It's really important to us because all of you will raise your hand if I say, how many of you want to place implants? Right? Everybody wants to learn to place implants. I get calls every day. I just started. I don't even know what titanium looks like, but I want to place implants and do an all-on-4. But all of you should realize that the best implantologists in the world, the best, are the ones that know how to restore. Because patients never come to you and say, I want 4 or 6 end-osseous threaded titanium fixtures with a micro-roughened surface and an aggressive thread design. And by God, doc, they better be a built-in platform shift. Right? Patients don't say that to you. They say, hey, doc, I want to smile. I want to live my life. I want to love my life. So you got to be able to be really good at making teeth to make patients happy and give them what they want. So our method is you learn how to diagnose, treatment plan, and restore implants, and you get really good at that. And then when you're good at that, you come in and we teach you how to place implants. Go to our live surgical training course, right? And then we follow you through that journey. We make sure you're performing well and finding and achieving unbelievable success. And we know our recipe works. And by the way, this journey, there's no timelines here because it's very variable. It's individual. Some of you will come out and have experience with implants and have done further training or have had experience working. And guess what? Your journey might be accelerated and a lot faster than others who don't know what even titanium looks like. But the goal is we tailor make this so that every step of your journey, we're ready to take that step with you. And so we're very, very proud of this. We have robust continuums around this where you're able to learn. It culminates in things like live patient education. We're very proud. Our TAG Oral Care Center for Excellence is probably the preeminent facility in the world where you can go to learn to place implants on live patients, right? In Chicago. It's an amazing facility, over 25,000 square feet, state-of-the-art, 16 operatories with all of the latest and greatest of digital technology to be able to deliver the most unbelievable care to your patients. So when you think about that learning journey, you see that we're very thoughtful in how we do this. We start you online with didactic theory. You come and learn in person, learn restorative care. You come when you're ready to learn surgical placement of implants. You can have live patient experiences, right? You're just an unbelievable continuum. But one of the limitations of any continuing education program in dentistry is it's static. You go in, you learn. It's great. It's fantastic. You get all excited. But what do you do Monday morning? What do you do at 10 o'clock on a Tuesday? How do you make it efficient in your practice? How do you make it so that you're profitable? How do you make it so it's easy for your teams to help you and support you? How do you make it so that you can, have the ongoing support you need? And so our implant journey is not just about that static learning. It's about dynamic learning where you're supported not just in those events as you go through your journey, but even each and every day with ongoing support. And I'm really proud because we've been building this team for years, right? Obviously starts with our Chief Clinical Officer, Dr. Arvinder Judge, and then we've built a robust system of both clinical and operational support. We have our clinical directors of implant support that go over the shoulder. If you're placing your first implant in the office, you've got a mentor over your shoulder to be there and guide you. We've got operational support to help you so that when your teams say, hey, am I maintaining my implant kits right? How do I set up in the operatory? How do I order implant componentry? There's resources to help them through all of that, right? And so we built this robust network where everyone in the offices can pick up a phone. You can talk to a doctor. You can have you review your cases so that if you're doing let's call it an implant placement or the oral surgeon's placing for you, you can make a surgical guide and it gets reviewed by experts, and you have that collaboration where we say, okay, this is a good implant placement. Well, maybe you should do this. Maybe you should do that, and really have the benefit of a lot of expertise behind you each and every day. Each and every day. I personally speak to hundreds of doctors every single day of my life. And it continues and builds not just with the ongoing support from a people perspective, but we built tons of robust processes around this. We've got a wealth of knowledge. We've got metrics that you can look at to look at performance. We've got your learning journeys. We've got ordering. We've got, a lot of educational content and resource behind this. And then the last thing is we layer in technology. And I alluded to this at the beginning of the lecture, but our partnerships are amazing. We build best-in-class partnerships so that you can deliver implant dentistry to your patients, not just in the most innovative concepts, but with the most innovative ways of doing that. Our best-in-class partnerships allow us to build relationships. And I want to be really clear. We don't dictate how you deliver clinical care, right? We support all of you, your independent clinicians across each and every Aspen office. So if you said, I want to place implant ABC, we'll support you placing implant ABC, but we also build great partnerships. And so not only do we have these wonderful relationships, but they're with best-in-class people. So our implant partner is Straumann, the #1 global implant company in the world. And over 97% of every implant that gets placed in our ecosystem is the BLX implant, which is the best implant in the world, right? We are the flagship provider of BLX implants globally. We're the largest provider of BLX implants in the world, right? We use unbelievable technologies like iOS, Trios. It's one of the best intraoral scanners in the world. We have 3D printing in the offices and with SprintRay, which is one of the best printing technologies in the world. And you can see this just continues. If I go down the list of technologies, it's really amazing the best-in-class partnerships we create. And so when you think about what implant dentistry is today, which is delivering the optimal care in the optimal way so that patients get teeth that look like teeth, feel like teeth, and function like teeth every single time. When you think about that, and you think about how you can become that clinician, how you can be supported in that journey, not just in a moment of time, but ongoing throughout your entire career. You think about how you deliver that care through the use of technology and systems and products and services that are best in class. We've spent a lot of time developing our implant continuums and our implant support to be able to deliver to you a promise that will be with you every step of the way and allow you to achieve those heights and unparalleled success. And so, with that, I want to thank you guys. I'm going to open it up. We have, I think, about 20-ish minutes left, right, Sammy? And so we'll open it up
Yep.
to some Q&A here, and see what you guys think.
All right, so
Thank
we've
you.
gotten a few questions and very great presentation, Dr. Wall. And the first question that I saw was, could you tell us some key points that we need to keep in mind while treatment planning for implants to avoid failure?
Sure, sure. There's a lot. And it really just depends on, are we talking a single tooth implant? Are we talking, a partially edentulous and we're doing a bridge? Are we talking about full arch? Are we doing overdentures? Are we going to something fixed? There's a lot of parameters in there, but I think there's a few kind of key take homes that we always think about. The number one thing is we do not just place implants in bone just because there's bone there. We always think about things from a restoratively driven standpoint. The number one criteria for success for implant therapy is to be thinking from what is your end goal, right? So you hear this in the industry a lot. There's a lot of different ways that we talk about this, crown down approach, begin with the end in mind, um, reverse engineering, uh, just so many different restoratively driven implant dentistry. There's so many different terms for this, but the number one thing is you have to start with where you want to go. So creating a prosthetic plan is really critical. So if it's a single tooth, we're going to have a virtual wax up in the software. If we're doing an overdenture case, we're going to reverse engineer where the teeth should go in software before we start to plan where implants are going to be. So we can make good decisions like, do we have enough restorative space? Do we need to do bone reduction? Are we going to be able to do a screw retain restoration with or without angulated screw channel? How deep should the implant be? Like, these are all factors that come into play, but it all starts with, where does the tooth go? Because if you don't know where the tooth goes, you can't make any of those decisions. So that's, I think, parameter one is you always have to start restoratively driven. Parameter two is you should make decisions ahead of time in software. There's no reason why you should go to place an implant and have not thought about the case at all ahead of time. And thinking about the case ahead of time is not looking at a PA, right? Right. It's not just, glancing in the mouth. It's taking the time to look in software, make really educated, sophisticated decisions, and then going and executing on that plan, whether it's through a guide, whether, we've got a huge amount of, we're probably the largest provider of guided implant placement in the world today, and we've got, tens of thousands of surgical guides that get printed. We have printers in the offices. We're printing surgical guides every day on site. So we have things like same-day guided surgery in the offices. We have some users that are using other guidance systems like navigation or robotics that I mentioned. But, by and large, we want to be able to execute on that plan. So diagnosing and treatment planning in software, making good decisions, executing on that plan. Those are the common themes that will allow you to predictably avoid any of those pitfalls.
Good
Great
deal.
question.
Good
Okay,
deal. All
what
right.
else?
Next question. Besides taking an intraoral scan, are there certain radiographs you must take in your office prior to placing implants?
Look, I think when you just do a basic intake around a patient, you're going to take some standard imaging, all right? So obviously, FMX is important. Um, I think the reality, though, is two-dimensional analysis doesn't really get you a lot today, right? We still take FMX and Pano and things of that nature because it's routine and we're going to file with insurance, with all those kinds of things. But the reality is you cannot really diagnose and treatment plan in two dimensions today. So everything that we do is geared towards three-dimensional analysis. And that really does simplify things because there's only like I said, there's only really two pieces of data you need from an acquisition standpoint through technology. One is where's the bone, and that's CBCT imaging. The other is where's the hard and soft tissues, surface scans, which is iOS technology, right? Intraoral scanning. So you take those, and then obviously you want to take some clinical information with some photography or videography, right? But the reality is like the way that we image today is really CBCT.
Good deal. All right, next one. Do you make an in-office made surgical guide or do you use dental labs?
Yeah, so that's a great question. We start our journey. We believe in guidance. For a long time, we partnered with third-party manufacturers to make our surgical guides. We have a design network today where we do all of the surgical guide designing through an internal network that gets reviewed by world-leading implant experts. So every guided case in our organization gets reviewed by people who have a ton of implant expertise. We collaborate with you, collaborate with whoever on your team is maybe placing the implant if you don't place yet. We're going to make sure that the design of where the implant planning should be is very thorough and predictable. And then we're going to execute by manufacturing the surgical guide through 3D printing in office. And so, yes, we do manufacture surgical guides in office. And by the way, we've designed a robust system where everything happens effectively in real time. So every day, there are cases where patient walks in the door with that fractured number 19 from the elbow to the basketball court. And within a couple hours, the clinician is placing an implant through a guide because the designs come back in real time and then they're printed in office.
Good deal. Resources are incredible. It's insane what technology's being able to do every
Yeah,
single day. All right, the
absolutely.
next question. Which systems do you all place currently?
Sure. So again, as I mentioned, you're the doctor, guys. We do not tell you what systems to use. You are the clinician. You make the decision. What I will say though is we build best-in-class partnerships, and I can give you about 35 reasons why I think the Straumann BLX implant is the best implant for you to deliver care with. And so we create very strong partnerships where we think you can deliver care to patients in the best ways possible. So because of that, we have doctors who choose to use, the partnerships that we have. So 97% of every implant that gets placed in an Aspen office today is a Straumann BLX implant, right? The best implant in the world. The reality though is I'm going to support you if you decide you're going to use an ABC implant. I'll support you in that. Okay. I'll help you do whatever it is you need to do because I really want the number one thing to be for you is patient care. You want to make sure you're delivering the best care to patients no matter what implant you're using. That being said, I hope that we can have a great, thoughtful discussion around why I would recommend the BLX implant. And right now, I can say confidently that the things that we do to create value for you around that make a lot of sense. And if it's the best implant in the world with the best surface technology, with the best connections, the best restorative solutions, the best ways of placing, the high success rates, the predictable nature of dealing with and creating restorations, like all those things matter. And so when we think about it, we'll support you with whatever you choose, but we have great partnerships around that as well.
Good deal. Are there restrictions to avoiding ASC, angled screw channel, to avoid stripping of screws and make a cement retained restoration?
Yeah, so I'm not going to go down this rabbit hole too much because I could spend the next 3 hours talking about this, but let me just give you the highlights. Number one, cement is bad in implant dentistry. The literature is very, very clear. When you use cement and you cement retain restorations on implants, you have a higher incidence of peri-implant complications with more severe peri-implant bone loss / inflammation infection. Cement is not a great medium to introduce into this equation of implant therapy. The science is clear that you've got higher complication rates and they're more catastrophic at that point. And the only reason to use cement is to avoid an unfavorable trajectory of the screw axis channel with a screw retained restoration. That's where ASC comes in. ASC allows you to angle correct up to 25 degrees. And ASC has been around. The technology was first invented in 1987, actually. It's been around for about 40 years, but it was reintroduced into the market in 2013, October of 2013. It was launched commercially back in North America. And so the reality is we've had ASC technology for over a decade now, mainstream in implantology. We do not get stripping of screws because of the off-axis connection between the screwdriver and the head of the screw. And we have extremely high success rates with screw retained restorations with minimal complications. And so the reality is there are no limitations to ASC outside of you can't angle correct an unlimited amount of degrees. It can only go and angle correct the screw channel up to 25 degrees. So you have to be in the ballpark of the right optimal implant placement so that you can angle correct to make a more favorable screw access channel. But I would
Very good.
always ASC over cement.
All right. Next question is, during the training period, how many implants would a doc on average place?
Yep. That's a great question. So look, here's the deal. Everyone thinks more is better. All right. If you place in a program 5 implants, it's better than if you only place 1 implant. If you place 10 implants, it's better than 5. If you place 15 implants, it's better. 20 implants, 30 implants. So here's the reality. What we've learned, we've trained hundreds of clinicians over the last many years. There is a fine balance in an educational environment between quantity and quality, because you have to learn not just how to place the implant. You have to not just get reps in how to place an implant, but you have to understand the why of it and why you're doing the things you do. And if you skew too much to one way or another, it's ineffective. Meaning if it's all theory, didactic, you get the why of it, but you only place 1 implant, it doesn't do you any good. And if you place 40 implants, but you don't even know what you're doing, you're just being told, pick up the drill, drill here, drill here, drill here, you don't learn anything. And both of those things translate into a lack of confidence when you go back to your own world. Instead, there's a very synergistic place in the middle where if you get a good amount of theory, of why, of mentorship, of thought process and education and reps, you get success and you get high levels of confidence. So what we found in a 3-day course is if you place, we shoot for somewhere between 15 and 20 implants at a course. If you place about 15 implants, over the course of 3 days, you will be working from 8 a.m. till 6, 7 p.m. every single day, right? The only way you can do more implants is if we keep you there till 10, 11 o'clock at night, which is not good for anyone. But if you do that with the right mentorship, with the right leadership, with the right expertise, the right faculty, you end up finding that you learn what you're doing, why you're doing it, and how to do it, and you get the reps. And what happens is you get a lot of confidence. So we know our recipe works. You place about 15-ish to 20 implants, and you learn the why of it, and you get the confidence, and our recipe works. And I know it works because when we look at the data, on average, anyone that's gone through one of our courses, on average, the average general practitioner comes out and within 9 to 12 months is placing 8 or so implants a month, right? Which is about 100 implants a year. To frame that for you guys, if you're a GP placing implant provider, if you are a general dentist placing implants, 90% of general dentists globally that place implants place less than 50 implants a year. Less than 10% of GP placing implants place 100 implants a year. Less than 10. And on average, our clinicians place 100 implants within the first year and continue to do so. And by the way, then they grow to 150, 200, 250, 300 implants a year. So we know our recipe works. It's the right mix of quantity and quality.
Good deal. All right, I'm going to put two questions together, but there's a couple people asking how long is the training period, and then
Yep.
also asking, are these implant courses sponsored for employees?
Yep. Okay. So first off, I'm going to just say in general, the learning journey is variable. How long is the learning journey? It depends on your experience, right? When you're ready to take a step, we're ready to take a step with you. For some people who come in, they have expertise. We get them placing implants basically on day one. Other people who don't know anything about implant dentistry, they got to go through and learn, how to diagnose, how to treatment plan, how to restore. It's a longer journey. I would say that our goal is if you come in and you know nothing, within 12 months, you are placing, diagnosing, treatment planning, restoring, and placing implants. All right, within 12 months. Some people, it's day one. Some people, it's 3 months, 6 months, 9 months. Some people, it's a little bit longer, 15 months, 18 months, because they're just, not as ready in their own journey. But when you're ready to take another step in your journey, we're ready with you, all right? And our goal would be to get you guys through the learning continuum as fast as possible, with allowing you to get the skills and confidence that you need. So I think that's part one. Part two is effectively how much does it cost, right? Was that
It
is it
was asking if
sponsored,
it's
right?
sponsored. Yeah.
Yeah. Yeah. So I want to be really clear. We support all of you clinicians, and we want to bring value to you. And I think we have the best implant continuum in the world. Um, a lot of that implant continuum, there is no cost to you, right? Um, there are some parts of that implant continuum where there are fees associated with it. Typically, it's the live patient courses because guess what? The live patient course, you're operating on live people. So what does that mean? We have to have a fully functional facility. So we have at our oral care center a fully functional clinic where there is a full-time director of implant prosthodontics. He's a prosthodontist that is responsible for clinical care because we believe in comprehensive care. We don't just, when this isn't, the Caribbean or Mexico where you go in, you place implants and we never see the patient again. We believe in lifelong care for these people. And so we have a full team that includes hygiene and assistants and everybody else. And so there's investments that have to be made to be able to support patient care in the oral care center. So when you come for a live patient course, there is a break for you. The average single tooth implant course, if you're going to place 15 implants over 3 days, will cost you somewhere between $20,000 and $30,000 if you're just a dentist and you go look on the internet. Okay. Some courses say it'll be, 15 grand, but if you want a good quality course, somewhere between 20 and $30,000. Our investment when it comes to going to, let's call it, the surgical implant course is about 10 grand roughly. Right. So it's already a significant discount. On top of that, we have mechanisms where if you're diagnosing and treatment planning a lot of implants, you're restoring overdentures, you're like building yourself up in your career, there's ways that you can get that discounted tuition. So we have people that go for free. We have people that only pay, 50%, 5 grand to go to the course. On top of that, we also say, hey, if you do things like come out and actually place implants and are delivering care to your patients, we've got effectively educational grants where you can get reimbursed the cost of your tuition over the first 6 months after a course. And so it can end up being free. We have a lot of doctors that really don't have to make any investments to partake in the entire implant continuum. And we're really proud of that fact. We really want to make sure that it's there are the least amount of barriers for you to be able to get the growth and development that you want. And so we spend a lot of time building ways that can happen.
100%. The resources and opportunity is there. All right, next question. Are the implant restorations done via conventional impressions or digital scans or both
Yeah.
methods?
Yeah, I mean, listen, we have the ability to do both. 95 or 98% of every implant restoration we make is through a scan. Okay. Sometimes there's issues with, the depth of the implant, soft tissue. You can't get a scan body for whatever reason. So, we still, we'll educate you on material-based impressions, but literally 97 or 98% of everything that we do is scanned.
Good deal. All right. Do you use UV activation of the implant surface prior to placement?
We don't use UV activation of the implant surface. What we do, if you're familiar with the Straumann BLX system, the Bone Level X implant has a surface called SLA, sandblasted acid etched, which is the most predictable surface in all of implant dentistry. It's the most studied surface with over 25 years of evidence-based literature to support osseointegration on it. So the SLA surface is sandblasted acid etched. What Straumann does is they don't do a UV activation, but they have an activated surface by the carrier medium that it comes in. So they have the surface. The surface is actually called SL active because there's a carrier it's a nitrogen-based liquid medium that keeps the surface tension of the implant bioactive, and this is very similar to UV activation, but it's called SL active from Straumann.
All right. We'll do two more questions because we're coming to the top of the hour.
Sammy,
How do
listen,
you
this is India. It's 5:30 in the morning. I can stay on, 5-10 minutes later. If there's more questions, I'm happy
Okay.
to. If the dental students want to stay on, I'm happy to do that as well.
Good deal. We appreciate that. All right. So, how do you manage patient cases where implants may not be feasible currently due to the patient's health, history, social habits?
Yeah, I mean, listen, bottom line is you can't do care for everyone in every single way that you want. So at the end of the day, you have to diagnose and treatment plan. We're going to help educate you on identifying those patients, right? That's half the battle is knowing what to look for to see if they're a candidate, not even really for implants, are they a candidate for surgery, right? Can you actually operate on them? Are they a good candidate for implants? Are there red flags or markers we need to think about? What I will say is this: we want to make sure you have all the tools possible to be able to offer care to patients. So there might be patients where medically it's a challenge to place implants. Is it possible? Maybe, right? And if it is, it might be challenging. Well, that's why we build teams around you. You're not an island when you're in an Aspen office. At the end of the day, all 1,200 are independently owned offices. You're independent clinicians. We support you in that, but you are not on an island by yourself. You have teams around you that are there to support you. All of my teams are there to support you. We have oral surgery coverage. And one of the main reasons we have oral surgery coverage is for this question. When the patient has medical issues that may or may not make it challenging to do something like place an implant, we want you to feel comfortable saying, hey, listen, Mrs. Smith, unfortunately, you've got these things, and that makes surgery tough. But I've got great news. We've got experts on my team that allow us to build the right team to help you. And so I'm going to bring you in and introduce you to my oral surgeon because they're an expert in the field of surgery and implants, and they're going to be able to facilitate this. And so we'll build teams around you to help with those challenging health history patients, right? And quite frankly, if it was super challenging and to the point where it's not really a great idea to place implants, then we'll, be able to coach you and support you guys on, being able to talk to the patient and say, listen, here's why you're not a candidate for implants. But that doesn't happen very often.
Good deal. And just real quick, for those of you that don't know, our Aspen Dental offices, some of them have oral surgeons and endodontists who actually come into the office and take on those patients that are typically referred out. Just want to make sure you guys are aware of that.
Yep.
But
Yep. I'm going to actually say it's not some offices. It's the vast majority. Almost all the offices have coverage from oral surgery and endodontists to be able to allow you to leverage resources under one roof so that your patients don't have to go to 5 different places to get the care they need. They still come here. You're the quarterback of that team, and you just build the right team around you to deliver the care in the best ways possible to patients.
yep, makes it easier for the patient, the clinician, everybody. Um, all right, are Aspen assistants trained on assisting with implant placement?
Yeah, that's a fantastic question. Short answer is yes. We've got a lot of online resource for them. We actually have a course for dental assistants. So at the OCC, when we're running the surgical program, where you saw the pictures of it, and doctors are learning to place implants, we bring in assistants as well. And assistants learn from assistants, and they learn how to support implants in the office, how to take care and maintain equipment, how to support chairside, how to do all the things that are important with implant dentistry. So yeah, not only do we do this with online learning for dental assistants, we have the opportunity. I don't know anybody else that has a course for dental assistants to learn to support implant dentistry the way we do it. So yeah, we're very thoughtful in that endeavor. And by the way,
Awesome.
we do that with dental technicians. So we have courses for technicians to learn how to, design, and do implant restorations like overdentures, et cetera. We have it for hygienists, right? So that they learn how to maintain dental implants, right? So that your hygienist can maintain the implant therapies, et cetera, et cetera.
Good deal. All right, are there any limitations or challenges associated with the use of digital imaging in implant dentistry?
Um, I mean, like, I'm sure there's like an aggregate no, right? But yeah, there's always exceptions to the rule. So like, are there patients who, like off the top of my head, they're so they have so much dental work that you can't get a clean scan because of scatter. Could it happen? Yeah, but the CBCT companies are pretty good at having technology that reduces those kinds of issues, artifacts, and CBCTs. There are patients who can't sit in a CBCT unit, right? Because of health conditions, they can't sit or stand or I think the one that comes to mind is if you have like some extreme Parkinson's or something and you're not able to actually be immobile for the full time. That could compromise the use of technology from a CBCT standpoint. iOS, maybe there's some patients that have such limited mouth opening that you can't get a scan, but all these things are just far exceptions to the rule. By and large, 99.9% of every patient you will ever treat, yes, you use the technology every single time.
Cool. All right. Is there interprofessional collaboration with implant placement, crown delivery, etc.?
100%. So myself, I'll give you a great example. If you have a patient, all the time we get doctors who say like, "Hey, patient signed on. They're going to get a couple of implants. They're missing a few teeth, and I'm doing Motto, which is our aligner solution, right?" Um, they say, "What do I do first? Do I do the aligners? Do I do the implant placement? What's going on?" And you know what? Dr. Atai, myself, we talk with the clinician, we come up with the plan, we sequence it depending on what's appropriate for that case. So there's lots of collaboration when it comes to implants and orthodontics. There's lots of collaboration when it comes to implants and restorative, whether it's denture therapy, whether it's crown and bridge. We have tons of collaboration with oral surgery because one of the most common mistakes made in implant dentistry, especially full arch implant dentistry, whether it's fixed or removable, is not looking at how much restorative space you have and do you need bone reduction. So we collaborate interdisciplinary each and every single day. We believe in comprehensive interdisciplinary care. And we build teams around that. That's why we have a vice president of orthodontics, a vice president of oral surgery, a vice president of endodontics, a vice president of removable uh, uh, concepts. Like at the end of the day, we do wholeheartedly believe in that.
All right. Next question is, how much do you charge a patient for placing and restoring implants?
It's great. Listen, I think the easiest way, the short answer is it depends. It depends on the office because our pricing is competitive to what the market is in the area you're at. And so it's not I can't give you just a straight number because it changes. It depends if you're in the middle of, California versus Kentucky. But the way we believe pricing should be is it should be fair and it should be, I think competitive, meaning we're not going to be the most expensive, but we're not going to be the least expensive either. We're going to be somewhere in the middle, depending on what geography we're talking about, because we want people to see value in what we're able to offer. So we don't want to be the most expensive, but hey, we do dentistry in the best way possible with the best products and services in the world, with the best clinicians, all of you, with the best support, like people like Sammy, right? And myself and everyone else. And so at the end of the day, we also don't think that we should just go in and try to be the cheapest provider out there as well. So we believe that we're doing quality dentistry, and quality dentistry is an investment.
Love it. All right. So we'll end with this question. What can dental students be doing now in order to prepare themselves for, implantology in the future?
Yeah, look, I think as a dental student today, the best thing you can do is try to expose yourself to implantology outside of what you get from dental school because just by and large, it doesn't really matter what dental school you go to, it's not going to be comprehensive exposure. So I would say, try to read some textbooks is an easy way to do it. Look online. Um, if you want to watch YouTube for educational purposes only, not a how to and then go operate, right? I think a really great way to do it is when you get a chance, start attending dental meetings, right? Go to study clubs. Um, go to dental meetings if if they're convenient and there's a dental meeting in your area. Take the implant track. There's plenty of world class events that are focused on implant dentistry that have unbelievable, if not free pricing for dental students, right? Where you can go and you can spend your day and immerse yourself and just see what the world of implant dentistry looks like. Not that you're going to learn it and like be an expert on it, but the biggest thing you can do as a dental student is expose yourself to what is possible. So when you do come out and you graduate, you're not in these blinders thinking implant dentistry means this. Because any dental school you go to, you'll come out and you'll say implant dentistry means this. And the world of implant dentistry is like that. And so how do you go from this to opening your mind? You got to just get exposed to it. So I think that'd probably be my best advice is just be a sponge and take the time to see what's out there.
Awesome. Love it. Well, Dr. Wall, we thank you so much for taking the time and answering these questions and sharing all this knowledge and experience you have. And we really appreciate your expertise. Um, those of you that are still on, this was recorded, and I will be sending out the video. If you guys ever want to rewatch it again in the future, it'll be on YouTube as well. And we are also giving away $1,100 Amazon gift cards. So be on the lookout for a text message from your Aspen rep in your district. But other than that, I put my contact information on the screen, so feel free to take a picture of that or whatever and reach out to me with any other additional questions you have, questions down the road, if you want to shadow an office, whatever it may be, feel free to reach out. We're fully transparent. We want to help you guys the best way we can. Um, so thank you guys again for jumping on. And Dr. Wall, thank you again. Enjoy India. And